All of us, of course, forget things from time to time, but as we get older, you may get a little panicky thinking, oh my gosh, I'm developing Alzheimer's, or I'm developing dementia. My next guest does see a lot of elderly patients in her practice at Vanderbilt, Dr. Maria Duggan. Thank you for coming in.
Sure, thanks for having me.
So how do we distinguish, how do we know if the symptoms we're experiencing are part of just the aging process, or maybe dementia is in our near future?
Yeah, so the big difference is that with normal aging, there's no loss of function. So your processing speed may slow down. It may be harder to remember things. I really like the file cabinet analogy, that if you're 85, you have 85 years worth of files stored in your filing cabinet. It's going to take you a little bit of time, more time than it would to go through those than if you were, say, 30 years old and you were going through fewer files. So we know that processing speed slows down. Occasional forgetfulness can be normal. And those mild changes that happen with aging really don't impact one's ability to live independently and function day to day. So when we start seeing short-term memory problems or changes in thinking that impact one's ability to live independently, to, let's say, drive, balance a checkbook, to cook, to maintain yourself, your appearance, your social life, that's when we start getting worried about dementia.
So can you kind of describe the stages? I know there are different stages of dementia, what someone might experience and what it means to the person, not only with the disease, but we know it affects the entire family.
Right. So the stages of dementia, and dementia is just the umbrella term that we use to describe this syndrome that we see in folks as they develop memory or thinking problems that impact their function on a day-to-day basis. So basically there's early stage, middle stage, and late stages that we see. In the early stages, you may notice, like what I mentioned earlier, some problems in daily functioning with what we call executive function, higher order thinking, balancing checkbooks, being able to look at a bank statement and understand it, driving, getting lost in familiar places. And as the disease progresses, folks will lose more and more of those higher functions, and some of the basic functions will start to dwindle, like the ability to dress yourself, pick out your clothes, to toilet yourself, to bathe, etc. And that's the middle stages, which tends to be the longest. The late stage in dementia, folks are pretty much dependent with all of those basic activities: dressing, eating, walking. Communication is often severely impaired. They may not be able to speak very many words. They may not be familiar of their surroundings.
What it most commonly comes on, I'm guessing now after 70, 75 typically, but there are cases of early onset dementia and Alzheimer's. Is that still rare, or are you seeing more of it?
It is rare. It's the minority of cases, but we do see some cases of adults in their 40s or 50s developing Alzheimer's disease or other forms of dementia. Of course, there are many forms. The younger cases, it's always difficult, but it's especially difficult, let's say, if you have a teenage child at home and you know, dad's developing dementia. It can be pretty challenging. And most of the early onset tend to be familial or inherited forms, or folks with a genetic predisposition.
Is there anything people in that subset, is there anything those people can do to prevent it?
Not that we know of yet. Of course, there's many ongoing research studies that are going on to try to understand that basic mechanism, which tends to be based off of genetic changes. And so we're hopeful that there may be some therapies down the road, but at the time, not that I'm aware of.
So once someone is diagnosed with Alzheimer's, what can he or she expect?
So it depends when they're diagnosed. Of course, we know that Alzheimer's disease is diagnosed typically in the middle stages. So folks have already had symptoms for a few years before they actually come to a doctor and get formally diagnosed. And everyone's trajectory is a little bit different. Of course, you hear on average the lifespan is about 10 years, and you progressively decline in terms of your ability to take care of yourself, your ability to talk, eat, walk, etc. But everyone progresses at a different rate. We like to start planning as early as we can. So once we have a diagnosis, we like to engage with the family members in thinking about advanced care planning while the patient is still able to talk to us and express themselves and tell us about their values and their preferences and their goals, knowing that they now have a terminal diagnosis.
Let me ask you this in our final minute here. What impact are some of these meds having as far as slowing the progression of the disease?
So
Can you give us some hope?
Yeah, so in the early stages, we do use acetylcholinesterase inhibitors. Those are ones like donepezil or Aricept, and they can often slow down the progression. They're not magic bullets. They don't fix the problem, but they can also help not only with the cognitive symptoms, but also with the functional decline and prevent patients from having to live in nursing homes as the disease progresses.
So tough on the entire family unit, and the caregivers need help too along the way.
Absolutely.
All right, Dr. Duggan, thank you so much.
Sure, you're welcome.
Appreciate you coming in.
Happy to be here. Thanks.
All right, and a lot more coming your way right after this.